Hi YouTube, my name is Patrice. Welcome to my channel. This will be my first YouTube video, and today we're going to talk about my decision to get a breast reduction as well as my experience with my consultation. So I'm 34 years old and I have two kids. I have pretty much had big breasts since I was 10 years old. I remember going from like wearing like wife beaters or tank tops to like the next summer I had like full at least C bras, and I was very self-conscious about it. I was in the 5th grade when I first developed my breasts and was wearing bras, and I felt like I got a lot of attention for it. So at a very early age I started to like cover them up. I dressed in like big flannel shirts. I had a male cousin, we were the same age, we would like share clothes. Like I pretty much just dressed like a boy from 5th grade all the way through 12th grade. I was kind of like ashamed of how big my breasts were. I didn't want attention for them. Through college, everything was fine. I just had a normal college experience. Once I had my kids, I feel like they like tripled in size. As of now, I am a 38F, the last time I checked. And I recently started working out. I lost over 20 pounds, and the more weight I lose, it seems like the worse my back pain gets. Sorry, I'm saying a lot. The doctor that I went to, my primary care physician, asked me, did you really just bust in the room? Sorry, my dog wants to be here. This is Swiffer. Say hi, Swiffer. My primary care physician, we talked about my decision to get a breast reduction, and he said he wanted to see what would happen if I lost more weight. So that started a year ago. I've lost 22 pounds. I've been kind of up and down, but the more weight I lose, the worse my back hurts. And it's mainly seems like I've lost a lot of band size. I've lost over 6 inches in band size, but I have not lost anything in cup size. And I think that's what's making my back is hurting even worse, because I'm getting smaller, but my cups are not. So I was talking to a lady at the gym and telling her about my decision to get a breast reduction, and she referred me to her surgeon, Dr. Julio Sosa in Bloomfield, Michigan. And I scheduled a consultation and I went to see him on Monday, May 7th. I was very scared. I watched a lot of YouTube videos. I've been on Real Self, and I want to get my surgery covered through my insurance. And it seems like a lot of people have to go through a lot of hoops, you know, physical therapy, proof from your doctor. You have to have the marks in your shoulders, which I actually don't have. I get massages about twice a month, and I've paid for some very expensive bras. I think that's why I don't have the marks. But all of the other issues as far as back pain, neck pain, migraines, I have all of those symptoms. So I went to my consultation and I was just really concerned about not being approved from my insurance. I don't know really what my criteria was through my insurance at the time, but from reading other people's stories, it seemed like you had to do a lot to get approved. So I went to the doctor. Of course, they did the standard. They took pictures. They asked me about my symptoms. I filled out paperwork, and I had an opportunity to ask questions. I had about 30 questions written down, but one of them was, you know, how many clients had he had, or patients, sorry, had he had that went through insurance, and how many breast reductions had he done a year. And he said he did about 100 reductions per year. Most of his clients use insurance, and I asked him, what did I need to do in order to get approved? And he said the most shocking thing I heard thus far, and he was like, you're already approved. So I have Blue Cross Blue Shield of Michigan, and based on what he said, as long as you meet the criteria, you know, the size of my breast, the pains that I'm having, they pretty much approve you. You don't have to send in any letters. You don't have to wait for approval. Anything like that. So where I went to have the consultation, I thought I would be waiting at least a month to hear something back from my insurance. Before I left the office that day, I was actually able to schedule my surgery, which was very emotional for me. Like I'm ready to have a breast reduction, but I was like, wow, that was quick. So again, this was May 7th, and the first appointment they had available for surgery was May 21st, and that was like, ooh, that's 2 weeks from now. I'm not sure if I'm ready. I need to get some things in order. Like I said, I have 2 kids. I also have 2 stepkids, and I have one graduating from elementary and one graduating from middle, and I want to be able to make it to their graduation and their events. So May 21st just seemed like a little bit too soon. The next available they had was June 4th. And it felt like if I went June 4th with about 2 to 3 weeks recovery, I would pretty much be able to get out the house in time to go to their graduation. So we went ahead and booked for June 4th. I called my husband from the doctor's office and asked if he could take that week off of work just so he could be home with me, and he did that as well. And so I've been starting to research a lot more. I decided to make my YouTube channel. I wanted to film earlier this week, but I work a crazy schedule at work, so I wasn't able to sit down and do that. But this will be my first video. I'm going to do more. I've been like researching what I need post-op to make sure that I'm good. Anything I need to do pre-op, I'm going to be scheduling my pre-op appointment. I have to call back the week before my surgery to schedule that, and I'll make sure I actually film what happened during that appointment, show you all the things I bought to prepare for my surgery. My mother lives in Texas, and I called her and told her about my surgery, and she immediately bought a flight home, so I'm really happy that she'll be here with me for my recovery, and my sister will be here the week after that, so they both live in Texas. So I'm really excited. I'm nervous. Every day I spend time researching breast reductions, recovery. I try to find people going through the process with me. It's really hard. Most of the stuff I find is like a year ago. I haven't really found anyone very recent. So, and that's one of the reasons why I want to document my journey is I don't see a lot of videos documenting the full process of breast reduction, from making the decision to having a consultation, and everything that happens after that. There's not a lot of women of color. One of my main concerns was scarring and keloids. I do have keloid skin. I actually have one on the back of my ear. I don't know if you guys can see that. Probably not. So I did talk to the doctor about keloids. He told me that he does have treatment for that post-surgery, where I would come in and he would treat me for that to make sure that I'm not getting any keloids. We talked a lot about my concerns as far as how small I can go, with me being a F right now. He says he can get me down to a full C, so I'm really excited about that. I also was concerned about, I heard a lot about insurance picks what size you go to. So the doctor did call me to talk about my payment plan. Basically, the surgery costs $5,000 through their office. My insurance would cover everything, and I will have to pay was my deductible, what was remaining of my deductible, which ended up being $1,200. So they called me to talk about the payment plan for that, and I stopped to ask, hey, with the insurance approving my surgery, how much did they approve for you to take out, how many cc's? And got another shock where she said, your insurance doesn't require that. The doctor gets to pick how much he takes out, which really made me happy because I want to be either a full C or a small D. When we met for the consultation, I pretty much said no doubles, nothing bigger than a D. I've had D's or higher. Sorry, I had to pause. My husband called me. He locked himself out. So I'm going to start, go back a little bit. Can't remember all I had said already, but my surgery is scheduled for June 4th, and I want to talk a little bit about the consultation some more. Before the consultation, my cousin who just had surgery last year was like, make sure that you write down all of your questions that you have. And so I was researching on Real Self and on YouTube, just online, watching a few doctors who talk about consultations, and I wrote all these questions down. I don't know if you can see them. It's ridiculous. I'm crazy. But I was going to read some of the questions I asked and what the doctor said. So I asked where he performed his surgeries, and he does them at Beaumont Hospital, which is actually 1 mile from my house. So my surgery will happen in a hospital, and I would be staying overnight one night. He does do drains, and he said I would have those out about a week after the surgery. I asked to see before and after pictures. I just really wanted to make sure that he did good quality work, even though my friend at the gym went to him. She went to him years ago. She's an older lady, and I just wanted to make sure I saw his actual work. So he did have a portfolio where he showed me several pictures, and I definitely liked what I saw. Asked how small I would go, and he said he could at least get me to a full C, small D. Sorry. And I asked how many surgeries he does a year for breast reduction. So he said about 100 per year. And asked how long is recovery. I do a lot of desk work at my job, so he said about 2 to 3 weeks. If I did any heavy lifting, it could be a month to 6 weeks. I asked about working out. Like I said, I lost 20 pounds or 22 pounds over the last year, and I plan to lose a lot more. I want to lose at least 30 more this year, and just asked if he recommended me to wait to lose the weight after the surgery, or should I wait to get the surgery until I've lost the weight. And he told me that a lot of his patients who've had breast reductions have lost 30 to 40 pounds not too soon after, because they can do more upper body work. I do go to boot camp 5 days a week, and I find myself modifying a lot of my exercises because I can't do sit-ups. Anything that requires jumping is a no. Push-ups are hard, like anything pretty much upper body. I notice I lose weight in my waist and my hips faster than I lose in my arm. Actually, over the past year, I've lost, like I said, I lost about 6 inches in my band size. I've lost several inches in my waist. I've lost 2 pant sizes. My arm size, I have a big arm. I love it. I really don't, but has not lost any inches at all. So like upper body is taking longer to lose weight than lower body. So I'm hoping that after the surgery, then I can start losing more weight there as well. Sorry, I'm just checking my questions. Asked how long before I could work out again. He said 2 weeks for cardio and about a month before I can do the full upper body workouts again. I asked about follow-ups. So the first follow-up would be a week, and then 3 weeks, and then he said like 1 month, 6 months, 1 year. I believe he said 3 months as well. For some reason, I only wrote down 1 week. Asked what was included in the cost of surgery, and everything for surgery, post-surgery. I get one post-surgical bra. He had some ointments that we talked about, the treatment for the keloids, and he said anything that would happen during the first 90 days would be covered as well. We talked about the technique he uses, and just like most of the videos I've seen online, he uses the anchor technique. So pretty much where they cut around the nipple, go down, and then under the breast would be what I would be getting. He said that based on my size, I should not have to worry about having my nipple removed because he said I'm big, but I'm not that big, and I let him know. He said there's plenty of ladies bigger than you, and he laughed when I said, I know I'm the smallest in my family, which a lot of people, it's hard for them to believe, but with me being an F, I definitely have my sister, my mom, my aunts are all bigger than me when it comes to the chest, and I'm the first one to get a breast reduction. So I'm looking at them like, what were you waiting for? Like, I'm trying to pressure my sister to get one as well, but I think she wants to see me go through it first, so we'll see how that goes. So that was pretty much all of the questions I asked and everything he told me. After the surgery, about 2 days later is when they called and talked about how much my out-of-pocket cost would be. I guess they had to confirm if I had met my deductible, and if not, how much was left. They told me about $1,200, and I ended up paying it that day. I was kind of prepared for anywhere from $500 to $1,000 because it's May and I knew I hadn't really met my deductible, but I didn't know how much I met. So I did go ahead and pay the full thing off. I just want to have it done because I would have had to pay in 2 increments, May 17th and May 30th, I would have had to pay half and have that paid off before the surgery. So I just paid the full thing off. And it was better than paying off the full amount. So I'm definitely happy with what I had to pay, because even if I wouldn't have been approved for insurance, I talked to my husband about what are we going to do, because I've kind of made up my mind that this is what I want. I'm tired of my back hurting. I'm, tired of not being able to exercise fully. So I'm definitely happy that I made this decision. So I know I've been rambling a lot. Sorry, this is my first video, but I just wanted to share my why for getting a breast reduction, as well as what happened during my consultation. As I stated earlier, I'll be doing a video about my pre-op appointment. I plan to see if my cousin or my husband will vlog the day of the surgery for me, and then I'll definitely do more check-ins throughout to make sure that you guys can follow me along my journey. If you have any questions, please comment down below. If you're thinking about getting a breast reduction, or you've already had one, or you're already scheduled, just leave some comments, some encouraging words. It's very hard to find people in the YouTube community who are getting breast reductions or had them. I found a lot of other surgeries online, but not many breast reductions. So I'm really looking to help others out there that may be concerned, scared, or just find someone to go through the journey with me. So thank you for tuning into my channel, and I'll see you soon.